My name is Andy Steele. I am a certified prosthetist, orthotist. I'm also one of the owners here at Clark & Associates. I've been in the prosthetics field here in Waterloo for 25 years, and since 2002 I've been with Clark & Associates. I got in the field literally by accident, I tell people. I was in a farm accident when I was 12 years old and I lost my leg below the knee on the left side. I actually came up to see Dale Clark back in the early 80s, who is kind of our namesake of our company, and got interested in the field after that as I went to college at the University of Iowa, and then ended up going to Northwestern University for my prosthetics training, and eventually ended up back here in Waterloo. We see a wide variety of patients here in our Waterloo office, both on the orthotics and prosthetics side. As far as age range goes, we see patients that are 6 months old, and we see patients that are up to 100 years old at times. My philosophy in regards to patient care is really centered all about the patient, making sure that they have a good experience in our midst here. And that really includes everything from the time your physician or your therapist sends you over here, makes the phone call to make that first contact to schedule the appointment, from the setting that you are setting in, waiting for us in the reception area, all the way through the care that we provide to you. And ultimately, we want you to have a device or a service that we provide to you that lets you get up, get going again, and be as functional as possible. You know, I think sometimes in our daily work we take it for granted that we're working with patients that have had limited mobility for quite a long time in some cases, and I think we take it for granted when they start getting up and walking in, what a big impact that is on their life. And not only their life, but their family's life as well. So I try to never let that get old in my practice, and even after 26 years, I want to make sure that I enjoy that every day as much as the patient and the families enjoy that. Patients can expect a very personal feel when they come into our office. The reason being is that I was a patient and I sat on that side of the reception room at one time too, and I know what it's like to wonder what's going to happen, what the next step is, and it's really our job to make sure that we have a personal approach that allows them to have the greatest outcome possible, and that's really going to be important for me because I was one of those patients.